Kevin R. Loughlin, MD, graduated from Princeton in 1971, where he majored in biology. He then received his MD from New York Medical College in 1975 and completed his urological surgery training at the Brigham in 1983. He's been on the faculty of Harvard Medical School for over 2 decades, where he is currently professor of surgery. He received an honorary MA from Harvard in 1999 and an MBA from Boston University in 2000. Throughout his surgical career, he's had an interest in medical history, and he's written and lectured on this area a number of times. He has had a particular interest in the health of U.S. presidents and the impact of their illnesses on history. And it's on presidential health, from bloodletting to ballistics, that Dr. Loughlin is going to speak about this afternoon. Please join me in welcoming him.
Thank you very much. It's a pleasure to be here. And this topic perhaps is even more apropos when we look in the next few days. We're going to have, by all accounts, a very momentous election. And clearly, one of the interesting things looking back on American history has been the health and, if you will, illness of our presidents. Here, in many ways, you can say the most important patient in the world, and yet many times they've been the recipients of very unusual, let us put it, medical care. So with that as a background, we'd like to start with George Washington, the father of our country, who served over 200 years ago. And in December of 1799, George Washington was a dying man. He was at Mount Vernon and was literally on his deathbed. And he was attended by 3 physicians, Doctors Clark, Brown, and Dick. And they had, in those days, the treatment for many, many things was bloodletting. And it really was an outgrowth of the Middle Ages, where people felt diseases were caused by bad humors and recovery was caused by removal of the bad humors and entry of good humors. And bloodletting was felt to be a very legitimate treatment for a host of illnesses. The 3 physicians really didn't know what was wrong with Washington, other than about a week before he'd gotten a cold and had gotten progressively worse. But in those days, they actually had specialists, if you will, and George Rollins was the bloodletter. And they would come in and literally take blood off a sick patient. Now, this was written up about 5 years ago in the New England Journal of Medicine. And they literally went back and researched the events surrounding Washington's illness and subsequent death. As I said, in early December of 1799, he developed a head cold. By December 14th, he was having difficulty swallowing. Now, in retrospect, he probably had a very bad epiglottitis, which would be treated very easily with a course of antibiotics. But this clearly predated the antibiotic era. And at that point, 7:30 in the morning on December 14th, Rollins was called in and took off 400 cc's of blood from George Washington. Washington was also given a mixture of molasses, vinegar, and butter. And in those days, there were a lot of homeopathic remedies that were felt to be worthwhile. Washington did not improve. By mid-morning, Dr. Craik removed 500 cc's of blood from Washington. And Washington was then given tea with vinegar. Now remember again, in those days, there was no such thing as intravenous fluids. He was having difficulty swallowing. And other than a little bit of tea and molasses, it's reasonable to assume that essentially none of this blood loss was being replaced in any manner by any type of fluid. Things were not getting better. By mid-afternoon, Craik returned and removed, this time, almost a liter of blood from George Washington. and he was given calomel, which was a combination of mercury and tartar. And it was felt that sometimes inducing vomiting would be helpful. Again, perhaps getting rid of bad humors. And that evening, the father of our country, George Washington, died. One can speculate that he might have been in some degree of respiratory failure from this unsuccessfully treated epiglottitis, but you can also look at the fact that this was a man almost 70 years of age who had had 80 ounces of blood removed in a little over 12 ounces. Now, 2,365 milliliters is about half of your blood volume. And to remove that from somebody almost 70 with essentially no fluid replacement, you're just asking to put that patient into shock. So that although he probably had acute bacterial epiglottitis, the father of our country probably was bled to death. Now, at the same time that this was going on in some of the ironic twists of surgery, Benjamin Rush, who it's fair to say was probably the most prominent physician of his time, and was also the only physician signer of the Declaration of Independence, he had spent most of his career in Philadelphia. And concurrent with Washington's death, the reason that Benjamin Rush was not called in was he was in the midst of a malpractice trial. He was being sued for medical malpractice over 200 years ago. And the reason he was being sued was for the use of bloodletting. So one of the ironies of history, that at the very time the most prominent physician of our country was otherwise occupied, the father of our country was in all likelihood bled to death due to an acute epiglottitis. Now, we next move on to Andrew Jackson, some decades later, 1829 to 1837. And again, the same calomel that was used to treat Washington was used to treat Jackson. And Jackson, in retrospect, it appears to be, although he had his own set of chronic illnesses, was a bit of a hypochondriac, if you will. And he really relied a great deal on calomel. He also took sugar of lead. And over a century later, it was speculated that perhaps Jackson died of chronic lead poisoning, that inadvertently Jackson and his physicians had over-medicated him with lead. And this prompted a report in the Journal of the American Medical Association where they actually were able to exhume Jackson's body and took hair samples and analyzed them for lead. And it appeared inconclusive. So the conclusion of the authors in JAMA was that Jackson probably died of natural causes and not of a lead overdose. Now, Grover Cleveland is remarkable politically in that he was the only president who did not serve 2 concurrent terms. He was interrupted for 4 years and served from 1885 to 89 and then again from 93 to 97. His history is perhaps, in my mind, the most remarkable of all the presidential health histories. What went on around the illness of Grover Cleveland is really remarkable. In his second term, within a year of his reelection, he developed a lump on his left palate. Now, he was a chronic cigar and pipe smoker, although in those days the association between tobacco, smoking, and pipes and cigars had not been recognized. But because of this lump in his left palate, he had a biopsy performed, and it was reviewed by William Welch, one of the prominent physicians of his time down at Hopkins, and it was felt to be a malignancy. So now you have a president with a malignancy and what to do next. Now, many of you may remember that at about this time, the country was in very shaky circumstances, if you will, because of the silver crisis. And again, as we see this theme throughout presidential history, for political reasons, it was felt not wise to make public the president's illness. So the last thing Cleveland and his supporters wanted was for the public to know that the newly elected president had a cancer on his palate. And he then went, and again a recurring theme, to a physician who was a personal friend. And many times it's treacherous to have a friend treat you. But Joseph Bryant was a New York surgeon and a personal friend, and Cleveland went to him with this dilemma of a cancer of the palate confirmed at Hopkins, what to do next, and we must do it secretly so the public does not know. And they arranged to form a small operating room on the yacht Oneida in the East River of New York City, behind Bellevue Hospital. And they took all of their medical supplies, everything that was going to be needed to perform surgery on the President of the United States, onto the pier behind Bellevue, boarded the yacht Oneida on July 1st, 1893, and then started to sail up the East River in relative privacy. And nitrous oxide was delivered by Ferdinand Hasbrouck. In those days, dentists were really the experts on anesthesia. So they had a dentist serving, if you will, as the anesthesiologist. R.M. O'Reilly, who had been Cleveland's personal physician, also administered some ether. And Bryant, who was a surgeon in New York City, W.W. Keene, who was a surgeon in Philadelphia, who we'll hear more about later, and Dr. Erdman, they did team surgery. And they performed the surgery on the yacht Oneida as it went up the East River toward Buzzards Bay, which is where the president's summer house was. And they excised this tumor of the palate on the yacht. Now, the Philadelphia Press, and some speculate that it was through a leak via W.W. Keene, the physician, but the Philadelphia Press published a story that was indeed accurate. But the story was denied. And Dr. Bryant, the attending surgeon and also a friend of the president, was quoted as saying this was an infamous exploitation of a toothache. That's all that was involved. Now, what is the worst case scenario when you're operating secretly on the President of the United States on a yacht in the East River? That's to have a positive margin on your surgical specimen. And a few days later, the pathology was reviewed, and there was a question of a positive margin. So now, the president, recuperating up in Buzzards Bay, had to be brought back for a re-excision to make sure they had gotten it all. And then after a little bit more recuperation, he returned to Washington, D.C. on August 5th. Another dentist fashioned a temporary prosthesis to replace what was excised of his palate, and the story ends somewhat happily as his wife gave birth to a second child, the first child ever born at the White House a few months later. And the president was then fitted for a permanent prosthesis that fall. Now, he died 15 years later of unrelated causes, cardiac and kidney failure. But the full account was later made known in the Saturday Evening Post in 1917, about a decade after President Cleveland's death, and the diagnosis of verrucous carcinoma of the palate was confirmed, and now we know that has a high association with cigar smoking, which Cleveland was, a cigar smoker. We next turn to Woodrow Wilson, who was president from 1913 to 1921. Now, through early years, Wilson was a fairly healthy child down in Virginia, except for dyslexia. In 1890, he became professor of political science at Princeton. And while on a lecture tour, before any of his political career started as governor of New Jersey or as president, he suffered a stroke, and he had some weakness in his right hand. And this was to begin what was a lifelong problem with vascular disease with Wilson. He was clearly a vasculopath, and this really would haunt him for the next 2 decades. In 1906, he suffered a major stroke, and he actually awoke blind in one eye, went to Philadelphia, was seen by Dr. de Schweinitz, and also W.W. Keene appears again. W.W. Keene was a neurosurgeon, and in fact was considered one of the fathers of neurosurgery, and is credited with removing the first brain tumor successfully. And Harvey Cushing, who was the first chief of surgery at the Brigham, credits W.W. Keane for his contributions to neurosurgery at the latter part of the 1800s and the early part of the 1900s. Now, Wilson, however, became governor of New Jersey despite this health history, and later was elected President of the United States. His personal physician, Dr. Grayson, who again was a personal friend, noted during 1914 and 1915 that Wilson was having progressive difficulty concentrating, and it belied his sharp intellect and attention to detail. Now, in 1915, his first wife died, and shortly afterward, he married his second wife, Edith Galt. And throughout the next 2 years, there was a pattern in Wilson's public career of canceling public speeches and public engagements with very short notice. And it's speculated that he may have been having TIAs, or transient ischemic attacks, during this period that was causing him some embarrassment that could not be anticipated and that caused him to cancel many of these assignments. Now, Colonel House, who was really his aide-de-camp and his, if you will, assistant president throughout his term, felt that by 1918, Wilson's mind was, quote, becoming leaky. Again, less and less mental acuity. Clearly, though, in a very critical part of our history, with the First World War raging in Europe, the question of what the United States' role was to be in the European conflict, and also, obviously, Wilson's greatest accomplishment, perhaps, the formulation of the League of Nations. Now, it was then noted in September of 1919 that Wilson suffered a massive stroke while giving a speech in Pueblo, Colorado. And at this time, he was literally storming the country trying to drum up support for the League of Nations to pressure Congress to ratify the League of Nations. And this stroke affected both his speech and his left arm. And perhaps because of his health and his inability to really take his case to the people, the Senate did not ratify the League of Nations. And Wilson considered that perhaps his greatest failure, that he did not get the League of Nations firmly established in the United States domain. Later that fall, he suffered a second stroke, and this caused him to be bedridden for 3 weeks. He went into urinary retention. The most prominent urologist of the day, and many credit as being the father of American urology, was Hugh Hampton Young, who was the chief of urology at Hopkins. He was called to the White House, to Wilson's bedside, to determine if anything could be done about Wilson's urinary retention. And perhaps what in retrospect was excellent surgical judgment, Hugh Hampton Young felt that he could not perform prostate surgery on Wilson because Wilson was too sick to survive the surgery. And in fact, with time, after a few weeks, the urinary retention resolved spontaneously, and Wilson was able to void again without having surgery. During this time, however, he was really severely compromised. He continued to have paralysis of his left arm. He had visual disturbances. And for all intents and purposes, Mrs. Wilson ran the country. She handled all the paperwork. She was at his bedside, but much of the time he could not really grasp what the issues were. And Mrs. Wilson, and to some extent Colonel House, made all the major decisions that needed to be made for the country. And this quote from Secretary of State Lansing, I think, says a lot, and also is this recurring theme that we see over and over in terms of presidential illness. That Lansing, the Secretary of State, mentioned to Dr. Grayson that the Constitution provided for the Vice President to assume duties. And Dr. Grayson became incensed. You would think, probably due to loyalty to his friend the President rather than from good medical judgment, and said that he would never certify that the President was disabled. During this period, despite the efforts of Mrs. Wilson and Colonel House, there were bills that were left unsigned, and the government was very, very inefficient. And as we mentioned, the League of Nations Treaty was ultimately defeated in the Senate. Again, Dr. Grayson talked Wilson out of resigning. Wilson himself entertained the possibility that he was unfit to continue as president. Shortly he served out his term, and then a few years later he died of a stroke several years later. Now, Franklin Delano Roosevelt holds the distinction for being our president for the longest period of time, from 1933 to 1945. He again had a fairly unremarkable childhood in terms of health, had typhoid fever in 1910, and then in 1920 ran unsuccessfully as vice presidential candidate with James Cox. But in 1921, as a relatively young man, he was vacationing with his family on Campobello Island, and he developed some fever and some leg weakness during this vacation in the summer months. Now, whom do you think just happened to be vacationing close by? Our man, W.W. Keane. He was there. So W.W. Keane was called to the Roosevelt house at Campobello Island. He actually, one of the biographers of Roosevelt mentioned that Dr. Keane charged $500 for this house call. And in 1920, you can do the math with the exchange value of the dollar, what $500 for a house call translated into. So W.W. Keane came over, made the house call, and made the wrong diagnosis. He thought, and perhaps this was his neurosurgical background, that Roosevelt had suffered spinal thrombosis and inflammation of the spinal cord. Another physician, Robert Lovett, made the correct diagnosis of polio. And clearly, the effects of polio would be with Roosevelt throughout his entire life. And it's really a testimony to Roosevelt's courage that he accomplished so much with that significant paralysis. Now, in those days, the relationship between the press and the president was far different as it is today. If you look at pictures of Roosevelt, you will almost never see a picture from below the waist. The press was respectful. They knew that the president had a severe limitation here, but it was never emphasized either photographically or in the written press. And actually, in 1936, at the Democratic Convention, Roosevelt fell off the rostrum, and that was never photographed and never shown to the public that the president had fallen. Now, in addition to the polio and the chronic effects that had on his lower extremities, he began to suffer other illnesses while he was president. In the late 30s, he developed really malignant hypertension. And again, in those days, there was only a very limited number of drugs that could be used to treat hypertension. He also developed bleeding hemorrhoids and anemia. His personal physician was Admiral Ross McIntyre, and again, Roosevelt had been Secretary of the Navy, and McIntyre was one of his friends from that Navy connection, if you will. And because of Roosevelt's blood pressure, and at that point he was also having some cardiac issues, when Roosevelt flew to Tehran to meet with Churchill and Stalin during World War II, Dr. McIntyre demanded that the plane fly at a limited altitude because he did not want to risk lower oxygen for the president because of his cardiac and vascular problems. Now, in March of 1944, he developed labored breathing, and he was seen then by Dr. Paulin at Emory University and Dr. Frank Leahy, who was a famous Boston physician who was the founder of the Leahy Clinic. And they made the diagnosis of congestive heart failure and treated him with digitalis, which was really felt to be a wonder drug in those days. And he was sent away, the president was, to rest at Bernard Baruch's estate in South Carolina. Roosevelt and his supporters, his inner circle, really felt that his health was going to be made a campaign issue in 1944, and that the Republicans would stress that during a war we had to have a president who was, 100% fit. And because of that, the contrast of young Tom Dewey, who presented the picture of a young, vigorous lawyer, was of great concern to them. And there was some tension between the group of doctors treating him and the political staff. And Dr. McIntyre, again, publicly stated and was quoted that the president's health is good, very good, he's in splendid shape. Now, Roosevelt, again during World War II, needed to go to Yalta, and they had three goals: to set up the United Nations, to decide on the boundaries and government of Poland, and to enter the war against Japan after the Nazis had been defeated. He went with his son James in July of 1944, and then soon after developed abdominal pain and was diagnosed having gallstones. And he continued to deteriorate in terms of his health in 1944, according to Joe Kennedy, who was the ambassador to England and the father of John F. Kennedy, Farley, who was one of Roosevelt's confidants and was the postmaster general, and Harry Truman, the vice president. The patient also began to lose weight, and one of the signs of inadequately treated congestive heart failure is anorexia, or loss of appetite, and subsequent weight loss. Now, FDR then needed the operation on his gallbladder, but Dr. Sterling, who was treating him, and also Dr. Frank Leahy, told him that he'd be best served by having the operation sooner rather than later, but Roosevelt wanted to postpone the operation until after the election in 1944. What is also not appreciated by most historians or the public, that in 1944, clearly, the outcome of the war is still uncertain. Roosevelt was out of Washington, D.C., both in South Carolina and in Georgia, trying to recuperate from his medical problems for 9 weeks out of the first 5 months of 1944. And clearly, although there was some communication in those times by phone and teletype and so forth, it was not what we now come to take for granted, so that during a critical portion of the war, the commander-in-chief was, if you will, out of the loop in terms of the Washington, D.C. locale. Now, he left for Warm Springs, Georgia in March of 1945, and at that point, it was becoming more and more apparent that President Roosevelt was a very sick man. And for the first time, never before then, until March of 45, the Secret Service began to be assigned to Vice President Truman, perhaps, if you will, in anticipation that he might have to succeed without too much notice. And down in Warm Springs, Georgia, on April 12, 1945, apologize for the typo, FDR collapsed, and he was attended by Dr. Brune, and it was diagnosed as a cerebral hemorrhage, most likely to his chronic, inadequately treated hypertension. Now, as a result of Roosevelt's death, where it was still not really clear in terms of chain of command, other than the vice president would succeed, people began to say, well, you know, what happens if something happens to the vice president, or the vice president who's now a president sitting without a vice president? And in 1947, Congress passed the Presidential Succession Act, really as a direct response to Roosevelt's death. And that is, or that was, the sequence of succession in terms of the individuals if something happened in the chain of command. And that continued for the next several decades. Dwight Eisenhower became president in 1953. And again, as a young man, he was really very healthy, and actually began his career at West Point as something of a football star. And he developed a serious knee injury at West Point that cut short his football career, but it wasn't serious enough to prevent him from being commissioned in the Army, and he really continued throughout his early adult life without too many problems. However, in 1949, after he had clearly left the Army and was a civilian, he developed an abdominal obstruction. And his personal physician was Dr. Howard Snyder, who again was a friend and who Eisenhower had met in the Army. And Snyder was only trained as a family physician. He didn't have any specialty training. But he was Eisenhower's personal physician then. And this, quote, abdominal obstruction was not diagnosed by Snyder as a heart attack, but another physician at the Oliver General Hospital in Augusta, Georgia, diagnosed this mystery illness as a heart attack. But it wasn't felt to be very serious, and quite frankly, as you look through the literature about Eisenhower in the late 40s and early 50s, it's essentially glossed over that Eisenhower really doesn't have any significant health history. But on April 16th of 1953, at the American Society of Newspaper Editors, he was giving a speech, and he became pale and dizzy and held on to the podium and almost fainted. And the White House put out a news release that he had been suffering from food poisoning, and he was seen by Dr. Mattingly from Walter Reed. Nothing much was made of that until 1955. He was in Denver, and he was visiting. Mamie Eisenhower was a native of Denver. They were visiting her family, and President Eisenhower awoke in the middle of the night with severe chest and abdominal pain. Mamie called Dr. Howard Snyder, who was with them in Denver, and Dr. Snyder said it's just a little indigestion. Give him a little, antacid, and we'll see him in the morning, but he should be fine. And by 8 a.m., he, quote, seemed to be improving. Dr. Snyder, the GP, saw him, didn't feel much of it, didn't call for help. But later in the day, they went to the Army Hospital in Denver and had his ECG, which was done at the house, reviewed by a cardiologist who felt that Eisenhower had suffered a mild coronary thrombosis. At that time, Dr. Mattingly, who had been sort of an attending physician, but not his personal physician like Snyder, and also Dr. Paul Dudley White from Mass General, who was considered the preeminent cardiologist of his time, they were flown in to consult. And they felt that Eisenhower had indeed suffered a massive heart attack, one that well could have been life-threatening. And later that year, they made the diagnosis with continued follow-up that due to this massive heart attack, Eisenhower had been left with a ventricular aneurysm, which is like an outpouching of the ventricle of the heart that's due to dead tissue. And that diagnosis made by Paul Dudley White and Thomas Mattingly was confirmed on autopsy on Eisenhower in 1969. Now, in 1956, he was treated for ileitis, and barium studies showed a, quote, normally functioning digestive tract according to the press, but in fact he was suffering from inflammatory bowel disease. So again, some misinformation. And he ultimately, in June of 1956, underwent a transverse colostomy, and this was performed at Walter Reed Hospital. And again, as many physicians will tell you, if you operate on a celebrity or the relative of a physician, a complication always occurs, and in fact, President Eisenhower developed a wound infection on post-op day 11. Now, the status of Nixon during this time was very vague. He was not called in. He was not given any of the intelligence reports. And Eisenhower, despite this illness and despite his surgery at Walter Reed, was functioning in total as the president. Eisenhower himself and his family members debated whether he should run in 1956. Doctors Mattingly and White advised him not to run. But Eisenhower then had a falling out with Dudley White and dismissed him as his physician, because Dudley White was getting some very good publicity being the consultant to the president's cardiac problems. But Eisenhower was told, much like Roosevelt before him, you need to go away and rest. So Eisenhower left Washington and went to the family farm at Gettysburg. And the type A personality that Eisenhower was, he claimed that he was utterly bored and was going out of his mind at Gettysburg. So he decided to run again for president. Now again, health issues in politics have been used many, many times. And Adlai Stevenson, who was the Democratic nominee running against Eisenhower, went on television the night before the election and said that it was unlikely that Eisenhower would survive his second term. And the quote was that a Republican victory tomorrow would mean that Richard Nixon would probably be president of this country within the next 4 years. Now, in fact, Stevenson was somewhat prophetic, because 10 months into his second term, Eisenhower did suffer a stroke. And it was not as severe as Wilson's, but it did compromise his ability to serve as president. And they really did have team government in the 1956 White House, and John Foster Dulles, the Secretary of State, essentially assumed the lead role. Again, much as had been the case with Truman, Nixon, the vice president, was really kept out of the loop and really wasn't, if you will, geared and prepared to be president himself if anything had happened to Eisenhower. We next move to John F. Kennedy from our own state, who his history in terms of the public health is obviously well known to everyone. But what is less known are some of the early medical problems that John Kennedy had. As a child, he was fairly sickly and was not robust. He was able, though, to serve in the Navy. During the Navy, he probably acquired a parasitic infection from his time in the South Pacific. This is from his discharge record, which the Kennedy Library was very nice to let me view at the Kennedy Library. And he was diagnosed at time of discharge as having a spastic colon and an early duodenal ulcer. And they also made mention of 8% eosinophilia, which is a type of blood cell that is indicative of either a current or an old parasitic infection, although the blood smears for parasites were negative. But in those days, many men that had served in the South Pacific came back with various types of parasitic infections. But it was really because of his back, which again may have been injured during the PT 109 episode, that the Board of Medical Survey felt that he should be retired from the Navy, which he was. Now, Kennedy then had his first back operation in 1944 at my hospital, Peter Bent Brigham, and in a quote from Ted Sorensen's book, Kennedy, Kennedy himself was quoted as saying, "Let me confine myself to saying that I think the doc should have read just one more book before picking up the saw." So he had a long convalescence from his back surgery. He then went on sort of a world tour, and this, in some ways, was orchestrated by his father, Joe Kennedy, who felt that young John, if he were going to have a future political career, which Joe Kennedy wanted him to have, needed a little rounding out and seasoning. So Joe Kennedy arranged for him to sort of tour the world and get an international perspective. However, while he was in London, he had a severe illness that, in retrospect, was probably an Addisonian crisis, and we'll get to his adrenal glands and his Addison's disease in a few minutes. He was sent back to New York City. He received the last rites of the Catholic religion and was then admitted to New England Baptist Hospital, where he was given DOCA, which was one of the early steroid supplements that was available at that time. And John F. Kennedy said to his friend Stuart Alsop, "They keep giving me these chemicals because I have this disease," referring to the Addison's disease. "It'll finish me off by the time I'm 45. And to George Smathers in 1949, again, somewhat prophetic, he says, "The point is that you've got to live every day like it's your last day on earth. That's what I'm doing." Now, at the same time, his father, knowing at this point they had diagnosed the adrenal insufficiency, also known as Addison's disease, started to put doses of DOCA around the country in safe deposit boxes, because DOCA was not widely available then, to protect his son if, again, as had happened in London, if he developed unexpected adrenal crisis. Now, this is a letter from Vernon Dick, who was a urologist at the Leahy Clinic, to William Herbst, who was a urologist in Washington, D.C., both very prominent urologists of their day. And at this point, in March 20th, 1953, John Kennedy was the junior senator from Massachusetts, spending most of his time in Washington, D.C. And what the letter says is it clinches the fact that Kennedy had been diagnosed as having Addison's disease and was being treated for it. And from Vernon Dick's letter, March 20th, 1953, again, courtesy of the archives of the Kennedy Library, when he was in Boston last week, his medical condition was checked by Dr. Elmer Bartels, who was an endocrinologist at the Leahy Clinic, who has been following his Addison's disease since it was first discovered. He plans to implant further pellets of DOCA on April 10th. He is taking cortisone daily. And that may explain why Kennedy always looked robust, why always had that, if you will, tan, because in those days the steroids that were being administered actually increased skin pigmentation. And it may explain Kennedy's wonderful appearance. Now, in October of 1954, his back problems continued. And he then went to New York Hospital for Special Surgery down on the east side of New York City and had a spinal fusion. He went into postoperative coma, and last rites again were administered. His physician was Dr. Nicholas, who later would become the team physician for the New York Football Giants. And Dr. Nicholas at that time was a young orthopedic surgeon trying to make his mark in academic surgery, and he published a series of cases in the Archives of Surgery in 1955 of undiagnosed adrenal insufficiency that occurred during during surgery, and how to, one, diagnose it and how to treat it. And case number 3, he included 5 cases, was an example of a patient with adrenal insufficiency due to Addison's disease requiring elective surgery. Well, many years later, Dr. Nicholas, after Kennedy's death, identified case number 3 as Senator John F. Kennedy. Now, this continued then during the 50s, and when Kennedy was running for president, again, the issue of health came up. And at that point in time, nobody wanted to admit that Kennedy had Addison's disease. And Ted Sorensen again said that Kennedy would refer to it when pressed as partial mild insufficiency or malfunctioning of the adrenal glands. Now, when Kennedy arrived in Los Angeles for the Democratic Convention in 1960, the governor of California at that time, Edmund Pat Brown, who's the father of Jerry Brown, again, the health and politics connection, Pat Brown, who was not one of Kennedy's supporters, greeted Kennedy by saying, "I understand you have Addison's disease," to tweak him a bit, if you will, before the convention. There was a denial that Kennedy took cortisone and a denial that he had any serious problem. Now, it is interesting to speculate, and perhaps apropos to next week, the election of 1960 was extremely close. And some of Kennedy's biographers, O'Donnell, Powers, and McCarthy, mentioned that with only a difference of 118,550 in the popular vote out of over 68 million cast, it's not beyond the realm of possibility that if Nixon had won the tight races in Texas and Illinois, he would have been the president, not John Kennedy. And one can only speculate if the knowledge of his Addison's disease and health issues had been more widely known, if that might have changed the votes of a little over 100,000 people and changed the course of history. Now, clearly, Kennedy's assassination is a whole topic unto itself that we will not go into today. But because of Kennedy's death, the 25th Amendment was passed by Congress in 1967, really allowing for more definition of presidential succession and also allowing for, if you will, the replacement of the vice president who's going to succeed to the presidency. And this was passed in 1967, and in fact, no further legislation has really been significantly changed since that time, except for a few tweaks here and there, which we'll speak about in a few minutes. Now, the difficulty with the 25th Amendment is it does provide for the president to sign over his powers if he's impaired. But the limitation is it has to be the president's decision to say, I cannot serve. There's no provision for an objective body like the cabinet, like the Senate, or a board of physicians who can say the president is unfit to serve. Further compounding the problem is that the selection of the presidential physician is usually on the basis of the personal relationship he or she has with the president, rather than any particular expertise in terms of that president's health problems. And even after Kennedy was elected in November of 1960, later that month, in the New York Times, the quote was, his only physical illness is an occasional glandular deficiency caused by his malaria, which requires him occasionally to take cortisone tablets. That's as close as it ever came to a public admission that Kennedy had Addison's disease. Now, Ronald Reagan is notable for being our oldest elected president, and his assassination was a disrupting event, and again threw the country into some turmoil. But in Reagan's characteristic humor, as they wheeled him into the emergency room at George Washington Hospital, and as he met his surgical team and they were getting ready to bring him into surgery, Reagan was quoted as saying, I hope you're all Republicans. And I think it should be noted that his surgeon, and I say this proudly as a physician, replied to Ronald Reagan. He said, Mr. President, today we are all Republicans. However, as Reagan was wheeled into the operating room, he never signed over the presidential powers to Bush. And this resulted, the famous scene at the White House when people are returning to regroup with the outcome of the surgery uncertain, is the president going to survive, and Al Haig walking in and saying, I'm in charge. Well, in fact, according to the Presidential Succession Act, Al Haig wasn't in charge, but someone obviously failed to tell him that. Now, again, one can speculate, Reagan, when he left office, was still active and alert, but just a few years later, his battle with Alzheimer's disease became public. And one can only speculate if perhaps he had been elected from 1985 to 1993 rather than 4 years prior. Could we have had a president well into his 70s who might have had some mental impairment? And again, how does one deal with that? It is not beyond the realm of possibility in the future to have a president who has a serious medical incapacity, and yet we really don't have any good way to identify it and to deal with it. Let's just speak briefly about presidential candidates. Again, close to home, the case of Senator Tsongas, who was our senator here, who ran for president, and as many of you may remember, he was the early leader in front of Bill Clinton, and early in the campaign of 1992 was really felt to be the favorite to become president. Clinton ultimately emerged as the presidential candidate, but Tsongas' health history has really an eerie feel to it if you just speculate on what could have happened. Now, in 1983, Paul Tsongas was diagnosed with lymphoma. He was treated with a bone marrow transplant. And in an interview with the Washington Post in 1991, when he was clearly being identified as a prospective presidential candidate, he said that in 1987 they found a node in my armpit, and to this day they disagree on what it was, but they pulled me in for a massive radiation. That's as close as he came to saying that he had recurrent lymphoma. And recurrent lymphoma after a bone marrow transplant augurs a very, very conservative prognosis in terms of ultimate survivability. Now, in 1992, Tsongas ran for president and almost beat Clinton. In April of 1992, just 12 days after he had withdrawn from the presidential race, the New York Times then described the 1987 node as a recurrence and suggested that the candidate and his doctors who had been interviewed had been less than fully candid. Now, on November 19th, 1992, which again, if Tsongas had continued in the race and had won, he would have been president-elect on November 19, 1992. At that point, he was brought back to the hospital and had a positive biopsy for recurrence. Again, if we can speculate a bit further, if that had occurred, if he had been president, he died January 18, 1997, which would have been 2 days before his second inaugural. One can only speculate on the impact it would have had on the world and the country to have a president-elect diagnosed with a recurrent lymphoma and to have a president serving his first term with the prospect of recurrent lymphoma and its treatment hanging over his head and the country's head. Again, John McCain, when he ran for president in 2000, the LA Times reported that he had a second bout of melanoma. Many of you may remember he had a big Band-Aid on his forehead, and it was admitted that, yes, he had had recurrent melanoma, but the New York Times, the LA Times mentioned that the key will be how thick each of McCain's tumors is, something the physicians have not disclosed. And when you're talking about melanoma, which can be a very, very aggressive and lethal cancer, what is critical in terms of prognosis is knowing how deep the melanoma is. And that was never disclosed to the public. Bill Bradley, again, the look of health, former athlete, pro basketball player. When he was running for president in 2000, his health became an issue, atrial fibrillation. And again, the press brought that up, and Bradley tried to dispel the rumors and the fears about his atrial fibrillation. They admitted it, but atrial fibrillation requires chronic medication of a blood thinner called Coumadin, and there is some increased risk with atrial fibrillation and stroke. So it's not a trivial disease. Now, to put things in perspective, in closing, if we consider the modern era of presidents, starting with FDR in 1933, during these past 7 decades, we've had 10 presidents. There have been 4 assassination attempts. So if you take the oath of office to be president in the modern era, you've got about a 50-50 chance of someone trying to take your life. 2 of the presidents died in office, Roosevelt of natural causes, Kennedy of an assassination. And yet, we still don't have a good method of how do we monitor the president's health and how do we judge his fitness to serve. It continues to be up to the president himself whether or not he signs over the power of the presidency to the vice president, even if he's just going in for a few hours of anesthesia, even if it's not a significant serious illness. And this is something that the Congress has either been unwilling or unable to come to grips with. But even in this presidential election, we have the issue of John Kerry having had prostate cancer. Now, Pat Walsh, who was his doctor down at Hopkins, said the likelihood of anything coming back is very, very remote. Dick Cheney, who's obviously a heartbeat away from the presidency today as we speak, has a significant cardiac history. These are issues that are important issues because these men clearly have a major impact on national and international affairs. And it is somewhat disconcerting that we have failed to really confront this as a nation and as a government. That being said, however, I feel it's fascinating to go back and look at what has happened to our presidents over the history of this country and some of the adventures and misadventures, if you will, they have suffered. So with that, I'll close, and I'll be happy to entertain any questions. Yes, sir.
Have you done any research on the Lincoln assassination? I've read some things that the way he was treated may have affected.
There is some thought that he was not treated appropriately, and that probing the bullet track was probably not a reasonable thing to do. Along those same lines, McKinley, and again, there's an awful lot of presidential history that one could speak about, and in the interest of time, I edited some things, but President McKinley was assassinated up in Buffalo during what was essentially a World's Fair in Buffalo, and he was shot in the stomach and died ultimately of what was poorly treated peritonitis, but they probed his wound initially, which may have actually stirred up the infection, and Teddy Roosevelt, who was the vice president, was called from a hunting trip to come to Buffalo because initially they thought McKinley was not going to survive. Then McKinley got better. Teddy Roosevelt left Buffalo. Then McKinley began to go downhill again, and then Roosevelt was called back to Buffalo. And there are a lot of people that second guess, if you will, the management of Lincoln and the management of McKinley. I think it's fair to say, though, that an intracranial wound in the 1860s would have almost inevitably resulted in a mortality no matter what was done. The issue of McKinley, however, even in those days, they might have been able to have President McKinley survive if he had been managed somewhat differently. Well, Lincoln, as you know, was 6'4" and tall and lanky, and there's a condition called Marfan syndrome, which has the stigmata of very tall, lanky people. And it's also associated with some cardiac issues and abdominal aneurysms and so forth. And again, early on, people thought maybe Lincoln was a non-diagnosed Marfan's. But subsequent examination of some of his medical reports would suggest that, in fact, he was not a Marfan's, and that was just his body habitus. He did seem to suffer, as did his wife, from depression. And again, it was not treated in those days, and how much of an impact depression had on him is hard to quantify. Mm-hmm. Yeah, that may be true. I can't specifically comment on that. But yes.
Would you have any suggestions as to remedial steps that could be taken?
Yeah, I think what the Congress needs to do is to say that the president certainly, in my view, should have the right to pick his or her personal physician, because they need someone the same way all of us can pick our personal physician. You need someone that you have a personal relationship and that you can trust. I think, though, what should be done is that the Congress should pass a bill where a board of experts, and they should be physicians who are picked for their expertise, as well as some public figures who are non-physicians, so that there's somebody to monitor the doctors, should be a review board that perhaps on a yearly basis just goes in and performs an exam and a review of the president's health, and then issues a public report that can be responded to by the president and by the personal physician of the president. And that should be public information in the public domain. I also think the second thing that the Congress needs to do is to have a process that is mandatory, that if the president undergoes any type of general anesthesia, that's an elective general anesthesia, that it is mandated by law that the president must turn over his powers to the vice president until such time as the physicians treating him say that the anesthesia has lost its effect. On an emergency basis, again, I think you could reconvene that review board and say, this president, although he's not going to die from these wounds, is going to be severely impaired, and we invoke the congressional ability to start the presidential succession, and that the vice president will serve as president until further notice. I do think we have to take the decision out of the executive branch and put it in the hands of a review board and the legislative branch. Yes, ma'am. I guess in large measure that depends on your view of some of the things that happened. There's certainly no medical evidence that he was impaired in any way, and there were several years that went by before he had manifestations of Alzheimer's and the time he left the presidency. So again, as best as I can tell, there is no good evidence that he suffered from Alzheimer's while he was president. Yes, sir. Well, again, that may or may not happen. In all due respect to Mr. Deaver, he's not a physician, and for full disclosure, I'm not a neurologist or any expert on Alzheimer's, but, there's a spectrum, and many older people, their memory isn't as sharp as it was when they were 50, but that doesn't qualify as a diagnosis of Alzheimer's. So, in my mind, it's sort of a continuum of where the natural aging process and its impact on memory ends and where Alzheimer's begins. Alzheimer's in its full-blown effect is really a debilitating illness. So I think it's still speculation whether, in fact, Reagan suffered from that. Yes, sir. And the reason was that there were no adrenal glands. They were so atrophied because, on a personal note, there was a urologist who was a very good friend of mine, Paul Peters, who was an intern at Parkland when Kennedy was shot. And he was on the team that tried to resuscitate, if you will, Kennedy when he was wheeled in. And they knew, it was a futile endeavor. But somebody in the presidential enclave told them about the steroids and the Addisons, and according to Paul Peters, they gave President Kennedy massive doses of steroids, thinking that, he was in adrenal crisis. One of the things, any type of trauma, your adrenal gland kicks in. So if you have adrenal insufficiency, you need that. But it was Paul Peters who said when they did the autopsy, his glands were so atrophied, they couldn't find them. Now that you can also see, not only is that a sign of Addison's, you can also see that with chronic steroid use because it replaces the natural activity of the adrenals. But it's unequivocal that President Kennedy had Addison's disease. And as best as people can pinpoint, it probably occurred around 1947. He didn't have it, apparently, during World War II and at the time of his discharge. Yes, ma'am. In the early 1800s, by Lincoln's time, people were not bloodletting, but in the early 1800s, 1810, 1820, that was felt to be the treatment of choice for many things. You've got to remember, in those days, they had no X-rays, they had no antibiotics, they had no cardiac medications. In the Civil War, the most common operation that was done was an amputation. They couldn't even set a fracture. So medicine in the early 1800s was very, very limited. And that's why they gave these, tinctures of lead and so forth and mercury because they really didn't know what they were doing. He said on a nonpartisan level, is it true to say that Nixon was a borderline paranoid schizophrenic? But just let me, I'm not trying to be evasive, but I have no psychiatric training whatsoever. And for me to speculate on that would be unfair. It is a mental illness. It is a mental illness. But that I would leave to board-certified psychiatrists. I would not touch that. Yes? Yes? Yeah. Mm-hmm. Yeah. Well, the questions were, in light of this review board, would this apply to presidential candidates? And in view of the mental aspects involved, would there be a psychiatrist on the review board? To answer the second question, I absolutely think there should be a psychiatrist on the review board, because the men and women who may be president in the future, I think, are just as likely to have psychiatric issues as they are to have other health issues. And I absolutely think there should be some role of the review board to have full disclosure of candidates' health histories. In other words, if you're John McCain and you have a recurrent melanoma, that's fine, and then tell us the depth and the histology of the melanoma, and then the review board, if they don't have an expert in melanoma on the board, which they may well not have, can go to an appropriate specialist around the country and tell the people the outlook for this is so forth and so on. The same thing with John Kerry, for instance. It would appear, as a urologist, that his prostate cancer has a very low chance of coming back. But why not tell people what the PSA and the Gleason score was and have that fully disclosed, where people can say there's a 96% chance of cure or an 89% chance of cure? I think that when you're going to run for the most important office in the world, it's the public's right to know all of your health issues. I don't think that's an inappropriate loss of privacy. I think that goes with the territory. And we've seen too many examples of where significant health issues were hidden, and they did have some impact later on. Yes, sir. Well, I mean, that may be giving a little bit more credit to Garfield's in terms of the advent of modern medicine. I would, quite frankly, I would put, if you had to say the advent of modern medicine, in my mind, would be World War II. That's when we really learned how to treat trauma. Penicillin was coming into its own, so we really had the antibiotic era. That was the foundation for the establishment of intensive care units in the 50s. So I would say modern medicine really has its foundation during World War II. But in answer to your question, indirectly, I think it's fair to say that if President Reagan had suffered his injury at the time of FDR, he probably would not have survived, because he did lose significant amount of blood. He had to have a chest tube put in to get the blood out of his chest and so forth. He may well have suffocated, if you will, from the welling up of blood if it hadn't been evacuated. Well, on that, well, thank you all for your attention.